Chapter 1: Introduction to Computers and Health Information Management. History of Computers in Healthcare: Modern Information Systems. Today we have wireless computers. They are often seen at the point of care, the place or location where the physician administers services to the patient, such as the patient's bedside. One type of device used at the point of care is the computer on wheels, COW, also referred to as wireless on wheels, WOW. Using the cow at the POC improves documentation because it is done as soon as the care occurs. Healthcare facilities have been working toward the electronic health record for decades. The electronic health record is an electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. Many healthcare facilities began the transition to the EHR after the American Recovery and Reinvestment Act of 2009. This law enacted an incentive program known as meaningful use. Today, cloud computing is a way to store data and run applications for many healthcare facilities. Cloud computing is a system that operates on a computer that is owned and maintained by a vendor. Storing data in the cloud facilitates sharing of information, which is important to healthcare. The data storage is at a remote location and information is moved via the internet. The internet comprises thousands of networks with millions of computers linked together to share data and information. Many facilities have a private network known as an intranet. The intranet is a private information network that is similar to the internet in that it uses internet technologies. However, its servers are located inside a firewall or security barrier so that the general public cannot gain access to information housed within the network. A firewall built around the intranet will prevent unauthorized access to it or restricted parts of the website. A facility's intranet might give updates on upcoming events, house the bylaws and rules and regulations, as well as the policies and procedures of the facilities. An extranet uses a set of connections of private internet networks outside an organization's firewall and uses internet technology to enable collaborative applications to allow external users access to the information system. This system can be used by healthcare organizations to allow patients to access health information and schedule appointments, and by vendors to allow healthcare facilities to monitor the status of orders. The impact of computers on healthcare. Technology allows the healthcare industry to use data in ways that enhance patient care, research, business practices, education, and public health. Technology has also enabled significant changes in such areas as patient safety, quality of patient care, and access to information. The impact that information systems have on patient care is seen in a multitude of ways, including actual improvement to patient care, patient engagement in healthcare, creation of evidence based medicine, creation of practice guidelines, and patient safety. The EHR provides immediate access to the patient's past history, current test results, allergies, and so forth. It also reminds physicians of tests that should be considered and helps with the quality of documentation. Health information exchange is the exchange of health information electronically between providers and others with the same level of interoperability. It allows healthcare providers access to patient information even if previous health records are located with healthcare providers with other facilities, whether local or in other states. Patient safety is a hot topic in healthcare and has been since the publication of To Err is Human, Building a Safer Health System. When the report was published in 1909, it stated that up to 98,000 people died each year in hospitals as a result of preventable medical errors. Patient safety has been enhanced through the use of technology. Examples include the use of barcodes to verify patient identification for medication administration, which will be discussed later on in Chapter 8. Checking medications ordered against allergies and other medications, also discussed in Chapter 8. Improved data quality through edits and standardization, discussed further in Chapter 2. And clinical provider order entry, also discussed in Chapter 8. Evidence-based medicine describes healthcare services based on clinical methods that have been thoroughly tested through controlled, peer-reviewed biomedical studies. Evidence-based medicine uses data analysis from the EHR and other information systems. The findings from the review of data in the EHR and other information systems are used to develop clinical pathways. Clinical pathways are a tool designed to coordinate multidisciplinary care planning for specific diagnoses and treatments. Another tool is the Clinical Practice Guideline, which provides detailed step-by-step guides used by healthcare practitioners to make knowledge-based decisions related to patient care. These are issued by an authoritative organization such as a medical society. Technology's impact on the HIM profession has been huge. Many tasks are now performed, including assigning diagnoses and procedure codes, managing the MPI, managing registries, transcribing documents such as the discharge summary, analyzing the health record, documentation of the release of information activities, and computer assisted coding. The HIM is now allowed to work virtually. This allows employees to save on transportation costs, allows them more flexibility in their job, can lessen distractions, and may lead to improved job satisfaction. Another option is providing HIM services at a centralized location rather than having staff at each individual healthcare facility. For example, ABC Hospital System has hospitals in Macon, Atlanta, and Columbus, Georgia. All of these hospitals utilize the EHR. As a result, most of HIM services for all of these hospitals can be performed in Atlanta, eliminating the need for two other HIM directors, coding staff, and space in all locations. There are downsides to both virtual and centralized departments. We may need increased security when employees access data remotely. The skills required by the HIM professional have changed significantly in light of technological advancement. The HIM skills of today include system implementation, databases, data governance, legal health record, data analysis, data mining, healthcare informatics, and much, much more. The HIM profession has changed from one that is focused on processing health records to one that is focused on data and information that can be used to monitor quality of patient care. With the EHR, data can be easily manipulated and turned into information. Many new roles, such as data integrity analyst, data analyst, and mapping specialist, have been created as a result. Health informatics is a scientific discipline that is concerned with the cognitive, information processing, and communication tasks of healthcare practice, education, and research, including the information science and technology to support these tasks. It is an interdisciplinary field whose goal is to improve healthcare. This improvement takes the form of development of standards as well as clinical pathways and clinical practice guidelines discussed earlier. Standards are scientifically based statement of expected behavior against which structures, processes, and outcomes can be measured. Data and information are not interchangeable. Data and analytics is the science of examining raw data with the purpose of drawing conclusions about that information. Data analytics is becoming more important to healthcare and HIM. The American Health Information Management Association sponsors the Certified Health Data Analyst certification. This advanced certification covers data management, data analytics, and data reporting. Data analytics can be divided into three categories: descriptive, predictive, and prescriptive. Descriptive analytics addresses the past to determine what has already occurred. Predictive analytics addresses the future to predict what will likely occur. Prescriptive analytics concerns what to do with what you have learned. Data mining is the process of extracting and analyzing large volumes of data from a database for the purpose of identifying hidden and sometimes subtle relationships or patterns and using those relationships to predict behaviors. Dashboards are reports of process measures to help leaders follow progress to assist with strategic planning. The dashboard provides the status on key measures. This allows the user to have the most current information in one location. This information may be displayed in line graphs, pie charts, and other displays. The dashboard would allow the user to monitor these key measures closely. Descriptive statistics is a set of statistical techniques used to describe data, such as means, frequency, distributions, and standard deviations. It is statistical information that describes the characteristics of a specific group or population, such as the mean cost for patients who have had an appendectomy. Inferential statistics is a set of statistical techniques that allows researchers to make generalizations about a population's characteristics on the basis of a sample's characteristics. Predictive modeling is a process used to identify patterns that can be used to predict the odds of a particular outcome based on the observed data. A healthcare facility can use one or more of these tools to perform data analytics. The choice would be based on the objective.